Sex education, in its traditional form, often overlooks crucial aspects of human biology, especially when it comes to the processes our bodies undergo at night. One of the most overlooked phenomena is the occurrence of nighttime erections in men and the engorgement of the clitoris in women. These processes are natural and vital, yet they're rarely discussed outside of academic or clinical settings. Both men and women experience these cycles of sexual arousal while they sleep, though it's much more easily measured in men. These nighttime erections are not just random occurrences, they serve an important biological purpose. Nighttime erections are an essential mechanism for keeping sexual organs healthy. They occur as part of the body's natural process to maintain and rejuvenate these organs. For men, erections during sleep are a sign of good blood flow, healthy nerves, and balanced hormones. For women, similar engorgement of the clitoris occurs, though it is harder to track and measure. When either of these processes is lacking, it could indicate deeper health problems, such as poor circulation, hormonal imbalances, or nerve issues. Poor sleep, for example, is often linked to a lack of nighttime erections. When sleep is disrupted or insufficient, the body is unable to perform its natural cycles of sexual arousal. This could be due to stress, anxiety, or other factors affecting sleep quality. Nighttime erections are the body's way of ensuring that the sexual organs get the oxygen and nutrients they need to function properly. If this process isn't happening, it's a warning sign that something might be wrong with the body's overall health. The absence of these nightly cycles is not just a sign of sexual dysfunction, it can be an early indicator of larger health issues. Erectile dysfunction, ED, for example, is often tied to cardiovascular disease, diabetes, and other chronic conditions. The absence of nighttime erections or poor sexual function can be linked to a lack of blood flow, which is often symptomatic of more serious underlying health problems. When these natural cycles stop happening, it's important to take note, as they can offer a glimpse into potential future health complications. To understand the significance of nighttime erections, it is essential to consider various aspects of sexual and overall health. One key indicator is blood flow. Good circulation is essential for maintaining healthy sexual function, and disruptions in blood flow can lead to various complications. A lack of nighttime erections may indicate poor circulation, which can ultimately lead to erectile dysfunction or other serious issues. Furthermore, factors like hormonal imbalance can also play a significant role in sexual health. Testosterone levels, for example, are crucial for maintaining erections and sexual desire. If the body isn't producing enough testosterone, it may affect the frequency and quality of nighttime erections, potentially signaling a hormonal imbalance. Hormones also regulate other aspects of physical health, such as metabolism, energy levels, and overall well-being. When hormone levels are out of balance, it can lead to various health problems, including sexual dysfunction. The concept of measuring nighttime erections is an intriguing one, though it's not something that most people would think to track. It can be done through devices designed to measure the duration and intensity of erections throughout the night, providing valuable insight into sexual health. These measurements can be indicative of overall blood flow, hormonal balance, and nerve function. However, while these devices may be informative, they're just one tool in assessing overall health, and they don't tell the full story. The quality of sleep, the presence of stress, and lifestyle factors also play a role in sexual health, so focusing solely on one aspect of the body's function can be misleading. When it comes to maintaining healthy sexual organs, it's essential to take a holistic approach. Lifestyle factors such as sleep, diet, exercise, and stress management all have a profound impact on sexual health. Sleep, in particular, is vital. A lack of sleep not only affects sexual function but also contributes to a range of other health problems. Chronic sleep deprivation can lead to hormonal imbalances, reduced blood flow, and other factors that can harm sexual and overall health. Stress, too, can have a significant impact on sexual function. High stress levels lead to elevated cortisol, the body's stress hormone, which can disrupt hormone production and blood flow. Over time, chronic stress can lead to erectile dysfunction and other sexual health problems. Managing stress through relaxation techniques, exercise, and other coping strategies is crucial for maintaining sexual health. Diet and exercise also play a significant role in sexual function. A poor diet, rich in processed foods and low in nutrients, can lead to poor circulation, hormonal imbalances, and other health issues that affect sexual function. Exercise, on the other hand, improves blood flow, boosts hormone levels, and helps maintain overall health. Regular physical activity is one of the best ways to support healthy sexual function and prevent problems like erectile dysfunction. The pursuit of solutions to sexual health issues has led to various treatments, some of which are more effective than others. Medications like sildenafil, Viagra, are widely used to address erectile dysfunction, but they only treat the symptoms rather than the underlying causes. Similarly, treatments like shock wave therapy, which have been used to promote blood flow and rejuvenate tissue, may hold promise but also come with risks. These therapies are not without controversy, and their long-term effectiveness is still unclear. Botox, used in some cases to improve blood flow and alleviate tension in the penis, is another treatment that comes with significant risks if not administered properly. While these treatments may offer temporary relief or improvement, they do not address the root causes of sexual dysfunction. The biggest issue with many of these treatments is that they don't always work for everyone, and they come with risks. Not everyone will respond positively to shockwave therapy, Botox, or other experimental treatments. Moreover, these therapies often address only one part of the issue, sexual dysfunction, while ignoring the larger health concerns that may be at play. In many cases, addressing the root causes of erectile dysfunction or other sexual health problems requires a more comprehensive approach that includes changes to lifestyle, diet, and stress management. The over-reliance on quick fixes like medications or invasive procedures also raises concerns about long-term health outcomes. While some treatments may provide immediate relief, they do not offer lasting solutions to the underlying issues. There is a risk of becoming dependent on treatments that do not address the core health problems, potentially leading to worsening conditions over time. Ultimately, the most important lesson to take away is that sexual health is closely tied to overall health. The absence of nighttime erections or sexual dysfunction can be an early warning sign of broader health problems, such as cardiovascular disease, diabetes, or hormonal imbalances. It's important to pay attention to these signs and address them before they become more serious issues. A holistic approach to health, focusing on sleep, diet, exercise, and stress management, is essential for maintaining sexual and overall well-being. The key is not to rely on temporary fixes or invasive treatments, but to prioritize a healthy lifestyle that supports long-term health and vitality.